It is also World Sickle Cell Day, a day to raise awareness and understanding about the disease, which impacts more than 250 million people globally, the majority in the Black community. Our chief medical correspondent, Dr. Tara Narula, and medical correspondent, Dr. Darien Sutton, both here to talk us through it. Dr. Narula, let's start with you. What do we need to know about sickle cell? Well,
this is a genetic inherited disorder affecting about 100,000 Americans. It's typically picked up when newborns get screened in the hospital by a blood test. And what happens is you form abnormal red blood cells, those cells that carry oxygen throughout the blood. Usually they're round and they move very freely through the blood, but in sickle cell, they take on a sickle or crescent shape. They become stiff, inflexible, rigid, and they get trapped inside the blood vessels, causing occlusions. And that can lead to kind of the hallmark of sickle cell, which is these acute pain crises. You can have acute pain that's sudden, severe in the belly, arms, legs. They also can have infections and other complications down the road.
And Dr. Sutton, turning to you now, for people who are living with sickle cell disease, what other risks are associated with it, and what does a day-to-day experience look like?
It was, Dr. Narula alluded to it, there are some complications that we see often in the emergency room. Pain crisis being one of the most common, patients coming in acute pain, needing that treatment. Also complications like anemia or low amount of functional blood cells, chronic kidney disease, and as you stated, it can form blood clots, increasing the risk of stroke. But the day-to-day reality is complicated by the fact that this disease, the burden of it, is majority affected by Black people. 90% of those within the United States who have this diagnosis are Black. And their day-to-day reality is complicated by racism and stigma, and it needs to be understood because unfortunately that often leads to longer wait times, a decreased likelihood of receiving pain therapy, and overall lower quality of life, and that is complicated in terms of equating to a decreased longevity. All of these factors are what leads to that outcome.
And let's talk about the therapies and the treatments. Dr. Narula, what options are out there and how accessible are they for folks with this?
Yeah, well, many individuals, as Dr. Sutton mentioned, really are undertreated. So kind of the ways that we treat them would be blood transfusions for the anemia. There are medications to use to prevent the pain crises, medications like hydroxyurea. Then the acute pain control itself, which happens to be usually treated with narcotics or opioids. And then there's lifestyle factors. So, for example, staying hydrated, avoiding extremes of heat or altitude or exercise, avoiding smoking. But unfortunately, there really is a stigma associated because when patients come into the hospital, lots of times we assume in healthcare, unfortunately, that they are drug seeking. And then the patients don't get treated for their pain as they should. And that can lead to a lot of stigma and really supports the idea that we need to be supporting these individuals with mental health for potential depression and anxiety that might develop.
The good news is, though, and I know that you've been following it as well, we've had a few on Good Morning America as well as Prime, that there are a lot of advancements in the research and treatment.
Incredible technology, science, and research that goes into this. One of them being CRISPR therapy, where essentially they take stem cells from the patient, they edit it genetically, and then give those cells back to the patient to help essentially act as a cure in many ways for this diagnosis. Now, this is complex, takes a lot of time, and right now cost is being understood, but I had a chance to speak to those who have received this treatment, and it was remarkable, them sharing how they were just excited to do the things that we take for granted each and every day. A young child jumping into a pool, normally that cold cold temperature might provoke a pain crisis, and he was so excited to enjoy the summer with his family and be able to do the things that every kid should be able to do.
Absolutely. Thank you so much, both of you.